All right, good evening, everyone, and thank you for taking the time to join us tonight. For those of you that do not know me, my name is Tanya Pintado. I am a wound and ostomy certified nurse here at the University of Miami. It is my pleasure to be your host tonight. We do have an interesting topic for tonight's presentation with Dr. Rojas. However, before I introduce our guest speaker, I do want to mention that during this session, you will have the opportunity to submit your questions and comments in the Q&A box located at the bottom of the Zoom screen. Or you can easily raise your hand with the raise your hand feature, also located at the bottom of the Zoom screen, for your chance to ask a question. We will get to the answer at the end of the presentation. Now, it is with great pleasure to introduce our speaker for tonight. Her name is Dr. Rojas. Her professional history starts in 2013, where she graduated from the University of Texas Southwestern Medical School. In 2013 through 2017, she participated in an OBGYN residency program at Brown University Women and Infants Hospital. She completed her fellowship at Maimonides Medical Center. I hope I pronounced that right. The Department of Surgery. She has received numerous amounts of prestigious awards and recognitions from different associations, has been invited to several commentaries, published book chapters, and journal articles. The University of Miami is privileged to have Dr. Rojas as the Assistant Professor of Surgery in the Surgical Oncology Division since 2020. It's a very impressive resume, and I hope that I had to consolidate a lot in a few sentences. So I'll let you take it from here, Dr. Rojas.
Sure. Thank you so much for the introduction. Do you mind allowing me to share my screen?
Yes.
Okay, let me try now. Okay, can you see the title slide?
Yes, managing sexual health concerns after ostomies.
Perfect, yeah. Okay, well, I'll get started. So let me just do one thing so I can see everybody's face at the same time. Perfect. So my name is Kristin Rojas. Thank you so much, Tanya, for that introduction. And I want to start off with a quick apology because I unfortunately need to get off this right at 6:30. So I'm going to go through some things and hopefully answer some questions. But if any questions come up afterwards, Tanya and Anna, feel free to forward them to me by email and I'd be happy to answer those, okay? I'll also give some resources here that will also have a lot of the information that I'm going to talk about. So you can feel free to take a screenshot of anything like this. If you want to post it online, you can tag Sylvester or myself. And with that, we'll get started. So I am a breast cancer surgeon. So you might be asking, why is a breast cancer surgeon giving this talk? Well, as Tanya mentioned, I've actually started my career as a gynecologist, and I have focused part of my career on addressing the sexual side effects of women of women with a history of any type of cancer. So cancer treatment can impact sexual function in a variety of ways. But tonight so a lot of my talks do focus on patients who have a history of cancer. And I know that's not everyone in the audience. So I'm going to make sure to try to touch on different aspects with different medical concerns. But ultimately, what I'm going to be talking about has to do with menopausal symptoms that even a woman without a history of any medical problem can experience. And this applies to everybody. So really, even if you see the word cancer and you don't have cancer, it can still apply to you. So if you underwent treatment, whether it's surgery, chemo, and you may have started to experience some issues and you may have done some late night Googling, what happens is you see it's all about men's sexual dysfunction or erectile dysfunction. And so there's actually not that much information out there for women with a history of medical problems who are experiencing sexual dysfunction. So I'm going to talk about the Music Sexual Health After Cancer program. It's actually not about music at all, but music is an acronym that stands for Menopause, Urogenital Sexual Health and Intimacy Clinic. And sometimes I may have brands on the slide that come up and I don't get any type of reimbursement for that. All of this is just from my experience running the program. So first I'm going to talk about menopausal symptoms. So First, a quick anatomy lesson. So most women are born with 2 ovaries, which make estrogen throughout their lifetime. The estrogen goes up and down throughout the month, and that's what causes a period or a menstrual cycle. Chemotherapy, surgery, radiation, and some medications to suppress the ovaries can basically turn the ovaries off, even if you still have them, and put you into a menopause, which, you know, really the sign of being in menopause, the first thing you experience is hot flashes. Radiation can also cause the ovaries to stop functioning, which can lead to menopause. And then there's some medications we give patients who have different types of cancer, like endometrial cancer or breast cancer, that block estrogen, and then some other breast cancer medications. But low estrogen, essentially, once the ovaries stop making the estrogen, results in less lubrication, less stretchiness, increased infections, vaginal pain, and some spotting after sex. And if you haven't been prepared for these symptoms, like no one told you that they were going to happen, they can be very traumatizing. So these symptoms can happen with cancer or surgery treatment at any type of any age, and they're extremely common. So for menopausal symptoms, I'm first going to talk about hot flashes. Hot flashes show up and are basically your body's barometer for when the estrogen goes low. So normal menopause is a gradual process, but if you get your ovaries removed or pelvic radiation, and you abruptly go into menopause, you can have really intense symptoms. And the first thing that happens is you start to feel hot flashes, which is essentially almost like a drug withdrawal. Like your estrogen does a lot of good things in your body. When the estrogen is gone, then you start to feel really terrible. So some ways to help with hot flashes: high intensity exercise in the morning, as long as your doctor says it's okay to do that, can help decrease hot flashes throughout the day. You can dress in layers and avoid triggers, and that's like spicy foods and alcohol, basically delicious things. And acupuncture can also be very helpful for hot flashes. There's good data behind that. And we actually have an acupuncturist at our cancer center. And there are some non-hormonal medications you can try. Like if you look in the older literature, you might find like where we would used to recommend things like black cohosh and other interesting sounding names. There's not a lot of evidence that those things actually work. But what we do have evidence for is a low dose antidepressant called venlafaxine. It's actually at a lower dose than we would use for an antidepressant medication. We also have another medication that is called oxybutynin, which we originally approved for overactive bladder, and that can help decrease hot flashes as well. So if for some reason, because of your history of cancer, because someone told you shouldn't take estrogen because you have a history of a blood clot, if you can't take estrogen to help with the hot flashes, then these are some options for you that are non-hormonal. Lastly, there's a supplement called Relisin from a company called Bonafide, and you can Google it to check out that medication. It's a supplement. So what about hormones for hot flashes? Well, this is actually probably like the best treatment because giving a little bit of that estrogen back helps the hot flashes go down, but they're not for everyone. The hormones get a bad rap. There's some data from the past saying that it may increase your risk of breast cancer. That's actually been shown not to be true, but they still have kind of a bad reputation. But estrogen, like I said before, does a lot of good things. So if you have a cancer type that responds to estrogen, like breast, endometrial, some ovarian cancers, and that's why you have an ostomy, then you should not take hormones because that can increase your risk of recurrence. And when I talk about systemic hormones, what I mean is hormones that are either a pill or a patch. So your whole body is seeing them. This is different from vaginal hormones, which is just like vaginal estrogen. Non-hormonal options also help, which I already told you about. And then if you don't have a cancer type that responds to estrogen and you've gotten the okay to take that, you don't have any other contraindications, like all of these types of cancers here, then you can consider systemic hormones, especially if you went through menopause before the age of 45. And we know that early menopause increases the risk of osteoporosis. And so giving some hormones back can actually help prevent that. May also help with your heart health. So ask your doctor if this may be an option for you if you have really bad hot flashes that can actually really disrupt your quality of life. So next, I'm going to talk about dryness and painful sex, which can be another sequela of radiation, chemotherapy, or pelvic surgery. So actually some vulvar symptoms are worsened by an allergic reaction. So when patients start to feel these symptoms, they may go to the grocery store and just like buy all these like topical products. And they actually have a lot of different chemicals in them that can start to make you develop an allergic reaction. And that is manifested as like burning, this feeling of irritation in the vagina. And so if that's you, then I always recommend patients stop using whatever they're using and avoid soaps in the vagina. The vagina actually doesn't need soap, and that's for anyone. I actually recommend nobody use soap in the vagina. The vagina only needs water. It's kind of like a self-cleaning situation. So you want to avoid feminine washes, because feminine washes that are over the counter, like Vagisil and other brands, actually kill the good bacteria. So the vagina, which is the internal part, and the vulva, which is the external part, the vagina actually has a balance of good and bad bacteria, and that helps prevent infection. The lactobacilli are the good bacteria, and all of these like soaps and chemicals kill the good bacteria, and that's what can cause symptoms like itching, burning, and inflammation. So the first thing I tell patients is stop products like these, because they actually, even though they're marketed as being safe, some of the chemicals in these products are actually banned in Europe as potential carcinogens or chemicals that cause cancer. So I also tell patients to avoid products with glycerin. Anything with an artificial fragrance can be really irritating. And this includes like fragrances in the detergents you wash your underwear with. And also I tell patients to sleep without any underwear, because the bad bacteria in the vagina actually don't like oxygen. So I just gave you permission to do that from a doctor. The second step is moisturization. So moisturization is different from lubricants. Moisturization, think maintenance. So just like you put your under eye cream on it at night, you're going to, if you're experiencing dryness and painful sex, you're going to start a moisturization regimen. You can do it every night after showering, or like at least 3 times a week. My go-to to start patients is single ingredient organic coconut oil, which you can place on the external vulva. It's solid at room temperature, but if you melt it in your fingers like this, it becomes an oil. And that can be really helpful, especially for patients who have burning and irritation after urinating, because urine is actually acidic. Vitamin E suppositories can be helpful, but I also really recommend finding a product that has hyaluronic acid. So that's the same thing in our eye creams. That molecule actually pulls moisture from the environment and holds it on the skin. And so there's some great vaginal moisturizers that have hyaluronic acid, and they're Good Clean Love, Hyalogyne, and these other brands here. These are suppositories, these rubbery suppositories, which are really great, but you can't use them if you're depending on condoms for contraception or pregnancy protection, because they may degrade the condom. So anything in orange here may degrade condoms, so don't use it. For recurrent bladder infections, you can also ask your doctor about a single dose gentle antibiotic that you can take after sex, which can help decrease those bladder infections caused by sexual activity. So remember, moisturization and lubricants are not the same. So a lot of patients start to feel a lot better when they institute a moisturization regimen. I've talked to you about non-hormonal options, but sometimes with really severe symptoms, the vagina can actually narrow and shorten. That makes sex really challenging. And so the way I treat that is by starting vaginal estrogen, which is different from estrogen, remember, that you take by a pill or a patch. And I combine this with dilators. And so we have some videos online that show how to use dilators. Basically, they help to stretch the vagina and increase elasticity to help make sex possible again. No studies have shown an increased risk of cancer recurrence with vaginal estrogen, and it works really, really well. So if you don't have a contraindication for this, I strongly recommend considering asking your doctor for vaginal estrogen for dryness and painful sex. There's some other options called vaginal androgens, like vaginal DHEA. Oops. The brand name for this is called Interosa, so you can talk to your gynecologist about that as well. It helps with painful sex. You want to discuss all hormone treatments with your doctors, but the non-hormonal options I told you about are pretty much almost safe for everyone, unless you're getting active pelvic radiation. If you're undergoing treatment for pelvic radiation, you just want to clear everything with your radiation doctor. So next is lubricants, and I just recommend these every single time. So you want to avoid lubricants. So remember, moisturizers are for maintenance and lubricants are for love. So you want to avoid gimmicks, flavors, warming, anything artificial, and really stick to some basic either water-based or silicone-based lubricants. If you're not depending on condoms, I really recommend just starting with a silicone-based lubricant. This brand here is the one I recommend a lot in my program. It's hypoallergenic. It doesn't have any extra gimmicks. Silicone-based lubricants are totally safe as long as you're not using condoms, because they can degrade the condoms. They are less sticky and you don't have to reapply them. The only thing I tell some of my older patients is like, just be careful if you get it on the floor, because it's like really, really slippery. So you don't want to slip and fall. And that's like a funny thing, but it actually could happen. And so there's different types of lubricants. Really, the ones you buy at the grocery store almost always are not the ones you want to be using. They have like a lot of chemicals in them. And so I'd encourage all of you to take a screenshot of this so that you can look these up online. And don't let your partner buy the lubricant, like you be in charge of the lubricant, because they'll just buy like whatever is at the store. There's a new push to do these like CBD lubricants. There's not a lot of data that they're any better, but some of my patients swear by them. But these are the chemicals you want to avoid in the lubricants that can be really irritating to the vagina. So you want to start early. Talk to your oncologist, talk to your doctor, talk to your partner, talk to yourself. Incorporate a moisturization regimen. Read the labels. So stay away from these long name chemicals. Look for products that don't have parabens, artificial fragrances. Find strategies for managing pain. You know, one thing I didn't talk about was asking your doctor for a referral to pelvic floor physical therapy, which is a special type of physical therapist that can help with painful sex. And they often have waiting lists because they're so great and everyone needs to see them, but get on a waiting list and they'll call you when they can see you. And I recommend that if that's you. Okay, so what do I don't recommend? Because as running this program, I have a lot of patients asking about all kinds of stuff. And so it's actually very interesting for me because I get to hear about, you know, things that people are reading about online. So what is safe with cancer or an ostomy? So the first thing is, oops, I'm going to actually just change gears and I'll tell you about what I don't recommend in a second. But talking about low desire, like that is the other big problem that patients often tell me about after treatment. You know, desire is really complicated. It's a psychological issue. You know, you've got a lot going on with your diagnosis, with treatment, but also if the estrogen is like dropped to the ground, you're probably not feeling very estrogen changes to testosterone, and testosterone helps with desire. So that can be another symptom that we don't always talk about. So we start by treating the dryness, pain, and pelvic floor muscle dysfunction. If you're someone who's taking an antidepressant, you can talk to your doctor about switching to what's bupropion, which is a different type that doesn't have sexual side effects. Some antidepressants have really severe sexual side effects. So I don't want you to stop taking it on your own, but talk to your doctor about maybe another option that's good for you. You want to talk about communication, relationship issues, sleep hygiene, super important for everybody, like no screens in bed. So that's like no Netflix, no Instagram. The bed is really just for sex and sleeping, and that's it. And then exercise. Exercise can really help with desire. So I also talk to patients, you know, like, okay, after treatment, you know, before you may have only had foreplay, now you need 5-play. So like really pay attention to the preparation. You can't jump into things like you may have in the past, and just make sure you're really paying attention to your body. So there's actually 2 options for desire that are prescription. One is called flibanserin or Addy. And you shouldn't take this if you drink a lot of alcohol, because if you drink more than 2 drinks a day, it can cause low blood pressure and dizziness, but it's okay to drink a little bit. Bremelanotide is an injection you give yourself before sex. Honestly, I haven't been able to convince anyone to try that, so I have not prescribed it. I do prescribe Addy the pill though, and I'd say probably like 50% of my patients say it helps with desire. Non-prescription options are Restella, which is the supplement you can get on the Bonafide website, which is like plant-based, hormone-free, and has actually had pretty good data behind it. Back to what I don't recommend. So vaginal steaming or vaginal detox. Your vagina does not need a detox. It does that on its own. And you actually should not do vaginal steaming because you can burn yourself and the vagina doesn't need steam. You want to avoid feminine washes. And then if any of you have heard of this or heard of like Gwyneth Paltrow's Goop website, they are advertising these like jade eggs that are like $80 that are these pieces of jade you place in your vagina. Don't do that. It doesn't help and they're expensive, and they can make your pelvic pain even worse. I tell patients to avoid vaginal lasers. So that's like Mona Lisa Touch and other types of lasers like that. because once you have chemotherapy or pelvic radiation, the tissues of the vulva and the vagina don't heal normally, and vaginal lasers actually cause tiny microscopic burns. And for them to work, they depend on your body being able to heal normally. So if you've received all these treatments or have had surgery to change your anatomy, I do not recommend this. And I'm taking care of some patients who've had pretty bad reactions to this. They're actually not FDA approved for use in the vagina. So no Mona Lisa touch or vaginal lasers. Okay, now how to prepare for intimacy with an ostomy. So first is nutrition. So in order to be more comfortable, you can think about preparing, for sexual activity, and that's by selecting certain foods and behaviors. You want to avoid drinking with a straw, which can cause gas, avoid carbonated beverages, cook your vegetables, and then other foods that can be really gas causing are these listed here. To avoid diarrhea, you want to do smooth nut butters, white rice, applesauce, and bananas. And so this can help kind of manage that from a nutrition standpoint. For odor, you want to make sure you're emptying the ostomy frequently, avoid alcohol, eggs, and fish. And these are some good foods to reduce the odor. And then there's an oral medication called Devrom, which you can take, which decreases the odor. And then there's also bag deodorizers. And then you can also remember that there's many ways to be intimate without penetrative sex. You want to confirm with your doctor that you can return to sexual activity. You want to talk to your partner and make sure, you have communicated about your concerns. And if you are more comfortable, you can wear one of these ostomy belts if that would make you more comfortable. So to summarize, start today. If you're having vaginal dryness and painful sex, consider moisturization, lubrication, and even maybe dilation. Start the conversation. Like, even if you ask your doctor and they look like, okay, I'm experiencing these symptoms, like, what do you think I should do? Even if they look really embarrassed when you tell them, like, the more patients ask these questions, the more we're going to be prepared to have answers for you. And so, like, if 3 patients ask them about sexual health after an ostomy that day, maybe they're going to go home, look up some resources and get them for you. These are the Instagrams. The Music Sexual Health After Cancer program actually has an Instagram. And if you're interested in hearing more information about what I talked about, you can check it out. I try to post videos and talk about, like, a lot of things that I spoke about here in more detail. And then obviously our cancer center has an Instagram. And with that, I think I can take a couple of questions.
Thank you so much, Dr. Rojas. We did get one question.
Okay.
1 second, let me pull it up. Okay, so the question was, I have a colostomy surgery coming soon that can that decrease my sexual desire? That was one of the questions. So I guess it's a pre-op.
Yeah, so, desire is complicated and has to do with, getting ready for surgery is a stressful process. I don't know the indications for this patient's surgery, but it's probably a lot of things going on. And so desire is complicated. Psychological concerns and extra stress can definitely make decreased desire. But, after your ostomy surgery, definitely take the time to make sure you're healed. Take care of yourself, both mentally and physically, so to make sure that everything is healed. And then talk to your doctor about being cleared for sexual activity. I tell patients who maybe are going through treatment and don't have sex for a long time, when they try to kind of jump back into it, they notice, like, oh, they don't feel as interested, or they're having pain. And so I tell patients, like, once you get cleared to have sexual activity, try to have sexual activity at least once per month, if possible, because it's easy for a lot of time to go by when you're dealing with all of the stress associated with this, but not having sex for penetrative sex or sexual activity for several months can actually mean that it's harder to fix your symptoms later on. So make sure you talk to your partner, even if you're not partnered. sexual activity doesn't have to be with a partner. And so that's something I'd really recommend trying to do. And it may not be as spontaneous as it was in the past, but making sure you keep those like aspects of your brain like still lighting up will help later on in making sure that you can get at least back to a baseline.
We have one last question, which is a really good one. Somebody asked, what do you recommend for increase in libido? I had a complete exoneration, but I have no hormones.
So so it depends on the reason for the exoneration, like cervical cancer and colorectal cancer. You can, this isn't medical advice, but you can consider getting some estrogen back, which I often will prescribe through a patch. And that can start to significantly improve desire along with other symptoms, but you need to talk to your doctor about that. Patients who have a history of endometrial cancer cannot get hormones. So cervical, vulvar, colorectal, lung, all of those things are fine, but as long as you talk to your doctor. And vulvar cancer. Yeah, so talk to your GYN oncologist, but systemic hormones or estrogen by a patch are not contraindicated usually. Every patient's different, so that's why I want you to talk to your doctor, because there are some times we don't prescribe them for different reasons. But vulvar cancer typically does not respond to estrogen. So that's the first thing. And then the second thing are some of the other things I talked about, like making sure you're getting exercise. Then there's also those supplements and there's pharmaceutical options. I tell patients we try non-medication. Sorry, it's going to take me a minute to get back to that slide. To try non-medications first. Look through your own medication list, see if you're on an antidepressant, do you want to switch, talk to your partner. I tell all the patients, I'm always talking to them about sexual devices, like they can help maintain desire. And then there's also these sexy podcasts that were created actually by women for women, and they're Dipsy and Quinn. So I check them out too, and hopefully that can help.
Awesome. Thank you so much, Dr. Rojas. I know that you have to go. So thank you for joining us.
Yes, thank you so much for having me. And any other questions, just feel free to email me. And thanks, everybody.
Will do. Thank you so much. All right, so I am going to share my screen because there was just a couple of topics that I wanted to touch up on. I understand that not everyone here is female, and there was a lot of female talk. So I did want to cover a couple of things. Give me one moment. All right, so it is very common to have erectile dysfunction. It can last, depending on the type of surgery that you had, it can last from 1 to 2 months to up to 6 months. It is believed that sometimes it is more of a psychological issue. You have a stoma, you start thinking about it too much, and that can cause some type of erectile dysfunction. That's why normally physicians like to wait about 6 months before they start ordering any type of oral supplements or other interventions. It is very important that you speak to your doctor prior to taking any type of medication, whether it be for erectile dysfunction or to increase libido, like she had mentioned before. Certain medications can interact with others. So that's why it is important to speak to your doctor. It is also very important to get the go ahead from the surgeon. So once you start feeling physically better, it is very important to speak with them just to get the clearance. There is certain type of procedures that will change how one has intercourse. So it is important to speak with the surgeon prior. I've never gotten this question, but it is something that comes up on all the literature. Please do not insert anything into the lumen or the opening of the stoma. Nothing is made to go inside unless you're doing some type of of irrigation, but nothing is to go inside. There is no nerve endings, so it's not like one will get stimulated by that. So please, nothing goes inside, only out. Water-based lubricants are great as well, like she had mentioned. Some tips that you can do before intercourse, you do want to check to make sure that your pouch is empty, and you want to make sure that you have a good seal. You don't want to be in the middle of everything getting hot and heavy and the pouch pops open or you have an accident. There is also very, very mini pouches. So if you know that it's about to happen, you can always go into the restroom real quick and change the pouch. It's about 6 by 6, very small. It's kind of like a stoma cap. You place it there, and when you're done, you change it to the pouch that you had, whether it be a drainable pouch or a Euro pouch. Ostomy wraps. You can place an ostomy wrap. They do have for men and women. The women come lacy. They even have a little pocket, so you're able to place the pouch inside just to prevent the pouch from flapping around. And when it comes down to men, you can get an ace wrap and wrap it around, or you can use some type of elastic bandage as well, and it'll help keep everything nice and secure. You're also able to grab some tape, fold up your pouch, and tape it onto your abdomen just to also prevent the flapping. When it comes down to the women and the ostomy wraps, you do have options. I know that some companies, they're great, but they can be a little bit pricey. So if you are looking for some type of alternative, women wear tube tops. So with that same tube top, you can easily push it down, and that will help prevent the flapping of the ostomy pouch as well. You do want to avoid positions that apply direct pressure to the abdomen or to the pouching system. However, when you are going to lay on your side, you do want to lay on the side where the stoma is, just to apply a little bit of support to the pouch and also prevent some flapping from going on. So even though I said that you want to avoid direct pressure, that means anything that requires you to lay down completely flat or maybe apply pressure directly to the abdomen, you want to avoid things like that. And you are able to use pillows or cushion for comfort. There may be certain positions in the beginning that may be a little bit uncomfortable. So it pretty much just takes a little bit of practice, and you need to communicate so that you are able to find comfortable positions that will satisfy as well. You want to do that. Then I wanted to share one last thing. Give me one moment. I wanted to share the website where you can find these wraps. All right, I'm not sure if you guys are able to see. Okay, so Ostomy Secrets is a great website. They do have a lot of things for men and for women. They don't only have things for intimacy, but they also have things for swimwear, for boxer briefs of everyday use. They essentially just have an extra pocket for you to be able to apply your pouch and feel very comfortable and secure at the same time. There is one more website that I did want to share. This is a very general website. It does not just have information on intimacy. It is the United Ostomy Associations of America. It's ostomy.org, and you're able to look up all types of information, whether it be prepping for the ostomy surgery, intimacy, fertility, diet, activities of daily living, anything like that. You are able to find it on their website as well, and you can free type it. They do have it separated by different types of diversions. So it's a great tool to have. Very good to know about this particular website. So with that being said, I don't know if there's any more questions, but I will take some. All All right, so we do have a question. If I know of any companies that have the wraps for double ostomies. There is also, there is one website, the one for the trial that we're doing, the Stealth Belt. So Stealth Belt, we will flag the link in the chat as well. They do custom pouching, and they also make it very pretty for the women as well. Lacy, different colors. If you do have a dual ostomy, I'm sure they can make you a custom belt, but that's one of the brands that I know with the dual ostomies for the Lacy. So they are able to custom make the pouches. Let's see. Do we have any more questions for today? No. All right. So with that, we are completing the ostomy support group. I understand that not everybody today was female, so I hope that I was able to touch up on a couple of things for the male ostomates as well. I do want to announce before I complete today's support group, if you or anyone you know is Spanish speaking, we do hold ostomy support groups in Spanish on the third Thursday of every month. We will have Dr. Jose Miguel Minyor speak on peristomal skin health on Tuesday, March 15th at 6 p.m. Eastern in Spanish. And then in English, he will be doing the same presentation on April 5th at 6 p.m. Eastern as well. It's a lot of great information. So I definitely recommend that you guys attend if you are able to. If you would like to be reminded about the meetings, please write your email in the chat and we will make sure to send you a reminder. You can always check our website at umiamihealth.org. Click on the Ostomy Support Group tabs and all the upcoming meetings will be posted there. I do want to thank all of you that have joined us, and I'm glad that we were able to spend this hour together, very informative hour. Please don't forget that all the links will be in the chat of everything that we had discussed. Have a great evening.